Hello guys, I am Yatinjeet Kaur and I am a tutor at Inspiring Minds Coaching. So here I am with my new video on the premature rupture of the membrane. So let's continue our discussion. Generally, what is premature rupture of the membrane? It is nothing but rupture of the membrane before the uterine contraction starts, and it occur before after 37 week of pregnancy. So if you are talking about the definition, so what is the definition? It occurs when the patient at more than 37 weeks of gestation with the rupture of the membrane prior to the start of uterine contraction. So this is the main definition. Also there will be the history of the gushing of the fluid from the vagina. So what? There will be the history gushing of fluid from vagina. Now what is the pathophysiology of this? This is a very important about this. So generally the pathophysiology, what you are going to see as the pregnancy age advances, so you are going to see there will be the increase of matrix metalloproteins, there will be the increase of cytokinins, and there will be the increase of collagenases. So what they are going to do these collagenases, they will degrade the collagen. So as they degrade the collagen, the membrane around the fetus are going to be weakened. So you will going to see what? You are going to see the premature rupture of the membrane or PROM. Other are generally there is a programmed cell death and the mechanical forces. So activation of any of these three factors will leads to what? Will leads to the PROM. Okay, so now there are certain infections or inflammation that are also the culprit for causing the PROM. That infections can be chlamydial or gonorrheal. So how the infections are going to cause this? Generally, as there will be the increase of cytokinins and there will be the imbalance of matrix metalloproteins, and there is one factor that is a tissue inhibitor, metalloproteins inhibitor. That TIMP will inhibit them and it will prevent the degradation of the collagen, and hence there will be the no rupture. So when there is an imbalance between this MMMP and TIMP, you can also see there will be the risk of having what? PROM. So now what are the other risk factors you are going to see? Other risk factors are including the over distension of the uterus. What are the factors that are causing the over distension? Let's discuss. One is the polyhydramnion. In this case there will be the amniotic fluid, more quantity of the amniotic fluid inside the uterus, which can also leads to what? PROM. And other are macrosomia. If the baby is motu, so in that case also the uterus is not able to control to handle the baby, and here the weight of the uterus will be more, and in that case also you will see what? PROM. Other is the smoking. If the mother is smoking or something, then it can also cause what? PROM. So what are the symptoms? How the patient is going to present? Now there will be vaginal bleeding or there will be vaginal discharge, and the patient complain like she is experiencing the pelvic pressure. So these are the main presentation. What else? There will be the leakage of the fluid, but before the uterine contraction, as there is no uterine contraction, but तब भी क्या हो रहा है? फ्लूइड लीकेज हो रही है. सो these are the symptoms of the PROM. Now the diagnosis. For diagnosis, first we will go for the speculum examination and then other workups we will do. in a speculum examination, the first one is what? Pooling. In pooling, what is happening? The amniotic fluid will accumulate in the lateral fornix or posterior fornix. So you will see there will be accumulation of what? Amniotic fluid. And the Fern test. Fern test is nothing but here you will take the cervical mucosa or that sample from the cervix, and when you put it on the slide, you will see there will, under the microscope, you will see that fern like pattern. This fern like pattern is because of estrogen. Now the estrogen that is present in the fluid, it will leads to the crystallization of fluid, due to which you are going to see what? Ferning patterns. The other is the nitrogen test. The nitrogen test is generally in this case, what, as you all know, the vaginal pH is acidic and the amniotic fluid is basic. The pH is around 7. So when you take this sample from the vagina and you put that sample on the that nitrogen paper, you will see there will be the blue coloration of the paper. Why? Because there will be amniotic fluid that will turn the nitrogen paper into blue color. So these are about the speculum examination. And one more test we are going to use in speculum examination, that is tampon test, or it is also known as the amniocentesis dye test. In this case, we will inject the dye inside the worm and to see whether there is any leakage or not, or you can insert the tampon and if when you take the tampon, if you see some color on the tampon, then you can say that there can be the chance of prom. So after all these speculum examination, when we confirm like she is having this, so after that after these tests coming positive, we will go for other workups, that is sonography for gestational age and anomalies, if there is any genetical anomalies or not. So you can go for that. Culture for chlamydia and gonorrhea. Generally the infection like these can cause chorioamnionitis and hence it can also cause prom. So urine analysis you can also go for. Now here comes, we will going to discuss about the management, like how you can going to manage the patient with prom. It is very important. So let's start our discussion. Generally, if we are talking about the management, what you are going to see, if the patient is having the chorionic amnionitis, you will go for cesarean section. So patient with chorion amnionitis, what you are going to do is delivery. As it is an emergency case, so you will go for C-section. Other, you can like obviously if there is any infection, it can descend upward and it can leads to chorioamnionitis, and this is very complicated situation. So for that we have one expectant management. What we are going to do in this expectant management is we just give the antibiotics to the patient to reduce the risk of chorioamnionitis and neonatal sepsis. So we will go for expectant management. In this we are going to give what? Erythromycin, or you can also give amoxicillin and clavulanic acid. So these are the expectant management. Other, you can go for steroids. Why we are going to give steroids? As we are going to deliver the baby, if there is a no lung maturation, to do that thing we just give the steroids to the baby. Steroids For what? For lung maturation. So guys, this is all about the prompt. So I hope you like my video. Please subscribe our YouTube channel, follow us on Instagram, and join our Telegram group, and download for IM app for the test series. And I hope you like my video. If you guys having any suggestion, please drop in the comment section. Thanks for watching my video.